Let's get the show started, shall we?
Live from BC Children's Hospital in Vancouver, it's the 29th Annual Miracle Weekend.
Yes, welcome inside BC Children's Hospital. You know, this place serves 1 million children living in BC and the Yukon. They treat the severely ill kids, of course, but they also take care of all those smaller things like the bad ear infection that happens at 2:30 in the morning or a broken elbow.
Those things can feel like big things to little people,
For sure.
I'm sure. So for the next 4 hours, all day tomorrow, we will give you an insight into so many heroic stories and how this hospital is such an important place to many families around beautiful British Columbia.
All right, thanks, Sonia. You know, all the doctors and nurses and all the caregivers here, I mean, it's a labor of love. It's their job to help all these sick kids. But in addition to that, they also help raise money. I'm here with Dr. Patrick McDonald, head of neurosurgery, and you're representing departments of Pediatric Anesthesia, Dentist, and Surgery at BC Children's. Dr. Patrick McDonald, tell us what you guys do to raise money. Not only are you great helping the kids, but you raise money. How come you go that extra mile?
Well, we do it to continue the great history of excellence here at BC Children's. We raise the money through a combination of different things, individual donations from surgeons, anesthetists, and dentists, and some other fundraising things. We sold samosas at lunch this year and raised over $5,000 just in samosas.
It's a lot of samosas.
It is.
All right, well, let's see what you guys did. All right, kids, here's your big chance. Flip that check. Oh, my goodness, look at that. Am I reading that right? 500. That's a lot of cash. Thanks so much.
I would like to now introduce you to our latest Miracle Maker panel, and it's made up of members of the surgical care team here at BC Children's Hospital. These are some pretty special people right here. So let me introduce them to you. Down at the end is Kat Lidstone, who is an operating room nurse. There she is. Dr. Sanjeev Gandhi is pediatric cardiac surgeon. Oh my goodness, what a responsibility that is. Dr. Andrew McNeely is a pediatric urologist. Trish Page is the program manager for surgical services. Besides Trish is Andrea Zazulak, surgical purchasing clerk and inventory analyst. These are the people that make this hospital happen, my gosh. Vanya Bodor, surgical educator. Beside Vanya is Dr. Brian Coakley. He is a pediatric surgery fellow here at BC Children's Hospital. And right beside me is Dr. Norbert Froese. He is a pediatric anesthesiologist. Thank you so much for being here. I understand it's your first time answering the phones for the Miracle Weekend.
Yes, this is the first time for our team. We haven't done this before, and we were truly excited to be here.
And you worked at the hospital for quite a while now.
I came here in '96, and I looked down the panel, and there's some people who are here when I arrived, and there's some people who are new. But we all come to work every day to do the kind of work that we do to look after the kids.
Yes, such important work. Thank you for doing it. Thank you for being here today. And let's make these people really busy. Okay, please call 310 BCCH or 310-2224.
We are pleased to introduce you now to our 2016 champion child. I had a chance to chat with Aiden Chin earlier this evening. 5 years ago, cancer tore apart Aiden's world and forced him into BC Children's Hospital for weeks at a time. But you know what? Cancer couldn't break the deep bond Aiden had with his brother and his friends. In fact, it did quite the opposite.
I don't expect my cancer to come back. It's a new chapter in my life. I guess there is a sense of being a child, being a teen again. So there are times when I do feel free. I don't think I could ever fully go back to what it was like before. Bren was 7 years old and I was only 11, so we both were just kids, right?
I had no clue. I heard the cancer word, I was just like, what is that? Okay, maybe I'm gonna see him tomorrow. My eyes kind of started opening up and I was just like, Aiden's not gonna be here for a while. I'm only gonna see him maybe a couple times a week. It just keeps on going in my head, like what if he was not gonna make it? What if I wasn't gonna see him at home anymore?
There were times when I was feeling really sick and out of it and tired, and there were times when it wasn't always the chemo, it was about how other patients in the hospital were doing.
You don't know what it's like, because I've been through so much pain, but I want to be here for 2 weeks. And they'd be here for 6 months, you say?
And I was sad that there were other patients and there were other children that were younger than me going through cancers that were harder than mine. Basically from that point on, I was like, why don't I try to get through it and then hopefully come back, help out. That's what I've basically been trying to do since I finished treatment. I got to join this club at the hospital called the Oncology Teen Group Club. It's something that you can't find out of the hospital. As a survivor, I'm still part of the teen group. There's still a lot of support that I can give to them and they can give to me, because there's an understanding that treatment isn't over when you're a survivor. There's still an emotional side of things. You have friends that are going through it, friends that aren't gonna make it through it, and that becomes a reality for you. It's not just over. Brooke was a friend of mine that I met in the hospital, and she became basically a sister to me. Brooke was definitely the closest friend that I had that I lost. The day before she passed away, I did get to see her in the hospital, and I did get to hold her hand, talk to her, and say goodbye, and tell her I loved her one last time. And I don't believe that you can accept something like that. You have to, I guess, learn to cope with it more. Before, I felt like cancer was something that was rare, that 1 in a ton of kids would be diagnosed, but it's not rare, and there's a lot of kids in oncology, children that are going through what you went through, and pain that is unexplainable. I want to be able to give back to those that have helped me in the hospital, that have made it so that I can go out there and be active and just live my life again.
It's a really good feeling that I could just go home and do something with my brother now. Without Children's Hospital, my brother wouldn't be here, so I'm eternally grateful for them being there.
I'm looking forward to staying connected to the hospital because it's been such a big part, giving back and pursuing the dreams that I have, and being able to do that because of BC Children's Hospital.
Miracle Weekend coming to a close, but what a weekend it's been. It's time to check in for a big total, guys.
It is.
Let's do it.
Before we do this, though, I really would like to say thanks to all the volunteers working behind the scenes who helped us out.
Yes.
You've been amazing. Yes. It really is a cast of thousands. So do we want to do this right now?
Yeah, we do.
Okay, let's do it.
All right.
Let's turn the numbers.
Okay.
8,
0, 6, 8, 1, 0. Yeah!
Angels are smiling, lifted by love, awed by the children, exploring their world of pure innocence, pure love. Mothers and fathers whisper their prayers, take joy in knowing that everyone shares their faith and hope and love. Little ones laughing, lost in their play, through grateful eyes you can hear them say, thank you all, thank you, thank you all, thank you. Miracles happen with love and with help from the angel in all of us. Miracles happen, oh yes they do. Here's hoping someday happens for you, and the peace comes to you from above. Miracles happen with love. Miracles happen with love, and with help from the angel and all of us. Miracles happen, oh yes they do. Here's hoping someday one happens for you, and peace comes to you from above.